You are a pulmonologist by training, specializing in lung and respiratory functions. Why do people with ALS need a pulmonologist?
Well, unfortunately, as you know, ALS affects all the muscles, including the breathing muscles.
So that leads me to my next question, and that is, what does a healthy respiratory function look like, and how specifically does ALS affect that function?
When we talk about the breathing muscles, there's really three groups we talk about. One group, the main group we talk about, is the breathing in muscles, taking a deep breath in, and the main one is the diaphragm. But we also have to breathe out. Normally, just sitting here, our lungs like to collapse. So once air's in them, if you just relax, it goes out naturally. But if you have to breathe out hard, like for coughing, and coughing is really important to keep the lungs clean, you have to use the abdominal muscles. The third group of muscles really is a really important group, and that's the throat muscles or the bulbar muscles, the swallowing and voice muscles. And they're really important because they protect the airway.
And in terms of disease progression, do you typically see that all three of those muscle groups affecting the respiratory function deteriorate at the same time, or is there asymmetry? One is strong and another is weak. Is there any pattern at all?
There's no definite pattern. So it varies from person to person, but in general, if you live long enough with the disease, all the breathing muscles are going to be affected.
I've heard a lot about the care team and the care plan with regard to respiratory functions and more broadly just managing the ALS. Can you tell me where you fit as a pulmonologist in the care team and the care plan?
The pulmonologist comes in when there's various interventions that we consider, breathing assist devices, like a BiPAP machine. There's lots of names for those, and even a tracheostomy, for example. But there's other breathing exercises that we do, and we get involved in that, and we help patients make decisions about the right timing for those things, and then troubleshoot if they have problems with them.
The troubleshooting is one of the questions I had about the care plan too. How flexible are they? And how much do you typically need to adapt to rapid changes in respiratory function with people with ALS?
Yep. Well, unfortunately, ALS is too rapid for everyone. But some people it's really rapid, and we're seeing them usually every 3 months in the ALS clinic. But if we think they're really rapidly progressive, we will see them every month or 6 weeks early on. And usually every 3 months is okay. That we can measure things and do adaptations, and the group meets and talks about swallowing issues and extremities and diet and nutrition. All those feed into the respiratory system. All plans are flexible. Nothing is written in stone. Anything we decide today can be changed later. We always tell people. Frankly, one of the reasons we ask a lot of questions about what people want or don't want or what they're willing to do or not do is because we want to do what they want. We want to be able to tailor our plan to what fits for them. And when they change the plan, we can change our approach. The patient is the ultimate boss. The patient can do what they want. The team is advising and suggesting and giving rationale for what we do.
What kind of symptoms should we be looking for?
I think probably the earliest symptom may be shortness of breath with exertion. So that's one of the reasons we do the breathing test. We may pick it up on the breathing tests before a patient is able to notice anything because of the other limitations. And the breathing tests are very valuable for that.
Do you have any final advice for people who've been recently diagnosed, who are looking at the challenges of declining respiratory functions, what we should be thinking about, what kind of guidance you'd give us?
I think the number one thing is to make sure you see a respiratory practitioner, usually a respiratory therapist, and are measured, and that's done in the ALS multidisciplinary clinics, whether that's through the ALS Association and their certified treatment centers of excellence, in their recognized treatment centers, or in the MDA centers that do pretty much the same thing for ALS patients. I think all those, if you go to those places, you're going to get the best treatment, best evaluation, and have the most modern treatment available to slow the progression or stabilize the disease as best as possible.